Let me welcome everybody. My name is John Monahan. I'm the Senior Advisor to President DeGioia at Georgetown for Global Health. I'm also a Senior Scholar here at the O'Neill Institute and the Co-Chair of the Lancet Commission on Global Health and Law. And we just want to thank and welcome everybody for coming here. I want to start off our initial comments by introducing Dr. Ed Hilton, who is the Executive Vice President for Health Sciences at Georgetown University. He oversees our medical center, our nursing program, and all of our health programs. So Ed, welcome. Thank you.
Thank you very much, John, and good morning, everyone. It's really a privilege to be here today with so many special guests to celebrate the publication of the Lancet, O'Neill Institute, and Georgetown University, it's a long phrase, Commission report and its comprehensive recommendations. This is a very thoughtful and important report, of course, and we are gathered here to share in this moment underscores Georgetown University's deep commitment to global health and to social justice. In addition to the values that infuse this report, the foundation of the work of this commission is also very familiar to us, because we recognize that the solution to many global and public health challenges often lies at the intersection of health and science with law and policy, and so is fundamentally an interdisciplinary enterprise. And just a quote from the executive summary of this Lancet Commission report summarizes this principle, I think, very well. Quote, working in partnership, public health lawyers and health professionals can become champions for evidence-based laws to ensure the public's health and safety, close quote. This report is a wonderful example of that important goal. Here at Georgetown, interdisciplinary collaboration also is a high priority for achieving our goals, and at its core, Georgetown's mission calls upon all of us to embrace this goal and to build stronger ties between the health and science community and the law and policy disciplines, all in service to improving health in the world and eliminating health disparities. Georgetown is very well positioned for this work, and we embrace this opportunity. In fact, Bill Triner and I often share the stage, and it's always a pleasure, Bill, to discuss another incredibly strong medical-legal partnership between our medical and law campuses, the Health Justice Alliance, which is focused on health disparities and based on our clear understanding that very often solutions to long-standing health problems requires the perspective of and collaboration between medical science and law, policy, and advocacy. And we're also training our respective students to look at health problems from those perspectives. So it's just another very important law and health science collaboration that I wanted to make sure I mentioned. Many in this room have contributed to the advancement of global health, both personally and professionally. I commend you all, and I know I speak for many of my colleagues across the medical center in expressing my gratitude for the very challenging and critically important work that has been accomplished here. I'd like to offer a special recognition and congratulations to the commissioners of this exceptional Lancet O'Neill Institute report on global health and law, and I really appreciate you including me in this celebration. Thank you very much. I think Bill Triner, you're next, Bill.
Well, thank you very much, Ed. And I think Ed captures what we've all come to realize, which is the great policy issues of the day require interdisciplinary answers. The time in which you just had legal solutions or medical solutions is past. And so at Georgetown, one of our great focuses is thinking about what the great challenges our society faces today, and then interdisciplinary initiatives to address that. And that's in particular true of law and medicine. So as Ed said, our Health Justice Alliance is focused on health problems in the District of Columbia and ways in which lawyers and doctors can work together to address them. But I think the initiative that really launched us and that is of the most fundamental importance is the O'Neill Institute. And I'd like to first recognize Tim O'Neill. Tim and Linda launched this in 2007. and it has made such a fundamental difference. So a round of applause for Tim. And I think, the core idea of the O'Neill Institute for 12 years has been thinking through a series of very pressing issues. How do you deal with Ebola? How do you utilize treaties? And what we're doing now is we're kind of after almost a decade, we're stepping back. And for 4 years, we've had this commission working with Lancet to think through the fundamental question of what role should law play in addressing global health issues. And so we have this incredibly important report that we're going to be thinking through today, but it really embodies a powerful step forward for this incredibly important initiative. So, I look forward to the discussion today. I want to thank Larry Gostin. A round of applause for Larry. So Larry is the faculty director of the O'Neill Institute. He has, as you all know, a lifelong dedication to the intersection of global health and law. He was co-chair of this commission, and he's really a visionary. And it's extraordinary what he's been able to do throughout his career. We're so grateful for Larry's dedication. I'd also like to recognize Dr. John Monahan, who's the senior advisor for global health to the president of Georgetown, Jack DeGioia. He serves as co-chair for the commission, and he has had, throughout his career, extraordinary commitment as a champion of global health. So, John Monahan. So, two more. This is really an extraordinary program, but two more people I want to recognize. Dr. Tedros, the Director General of the World Health Organization, who I think we'll be hearing by video later. And his priorities to transform the World Health Organization to provide universal health care coverage, improve women, children's, and adolescents' health, effectively manage global health emergencies, address the health impacts of climate and environment, demonstrate the possibilities in global health and the hope for the future. So we're so grateful that he's part of this effort and that he'll be speaking to us today. And finally, I want to acknowledge Representative Donna of Florida's 27th District, who will also be speaking here later. Dr. Shalala's advocacy work for women's rights, civil rights, increased access to health care, better education in public schools, a clean and sustainable environment. She's one of the great public servants of our time, and she also has made a profound change in the world. So we're delighted to be hearing from her today. So it's an amazing, I have to say, I was looking over the program, looking over the report. It's remarkable. And I want to thank everybody who worked on this report. I want to thank the commission. And I want to thank all of you who are here today for being part of this discussion and through thinking through next steps. So welcome all. And then I would like to call to the stage the man whose vision and generosity has made all this possible, Tim O'Neill.
Thank you so much, Bill, and welcome to everyone. And I'll start off by saying that some years ago, I was asked to speak to a group of researchers whose work I had funded. And so I went to the lead researcher for advice as to what should I say to the group. And he says, actually, it's quite simple. He says, all you have to do is imagine yourself as a corpse at an Irish wake. People will be very curious to see what you look like, but they won't expect you to say much. So in that spirit, what I want to say, first of all, when Lynn and I founded the Institute or came up with the idea of it 12 years ago, I would say the best expression of the mission of the Institute was actually on the cover of the Lancet, harnessing the power of law for global health. And if you're known by the company that you keep, the Lancet and the Institute has a nice ring to it. And it has a reputational throw weight for all the work that all of you are doing that really is wonderful. The guiding principle, as Bill and Ed had said of the institute, was that there's an underutilized capacity of the law to influence all the missions of global health, whether it's access, affordability, compliance, discrimination, actually global health justice. And that's really what this institute has spent the last 12 years forwarding. And I want to thank, as Bill and Ed have, first of all, Larry and all the scholars at the Institute and all the hard work that you've done over the last 12 years. Larry is one of those unique individuals where you have in one person a marriage of mission and capability. And you can see it by his enthusiasm for the work that he's doing and his prolific scholarship. And we wouldn't be where we are today without Larry's effort. I want to thank, of course, both Ed and Bill for engaging the broader Georgetown community in the mission of the Institute, both at the law school here, at the medical center, and the broader community. And of course, I want to thank all of you for spending the day with us and engaging on these very important issues. So as promised, that completes my prepared remarks, and I'm going to turn the program over to the founding father, Larry Gostin.
Good morning, everyone. Thank you very much for coming. I think I've turned it off. Good. This is really an incredible event for us. It's been going on for 4 years now, and to see it in fruition is just a wonderful thing for us. I think the people who came before me were the ones who really made this all possible, particularly Tim O'Neill and Linda, who is a nurse and a health advocate, and saw our vision very, very early on. Bill has been an incredible supporter of the O'Neill Institute. I couldn't have dreamt of having a dean that has the kind of vision and commitment that he has to health and to justice. Ed Hilton has given us that strength from across the campus, as we've got medicine and law. And of course, John Monahan has been an amazing co-chair with me for such a long time, and actually the first executive director of the O'Neill Institute. So welcome home, John. The O'Neill community is really an incredible community. We have a mission that I'm really very proud of, which is to make a difference in the world through world-class scholarship. So we're not only a think tank, and we're not only an academic institution. We use our scholarship to really try to impact the world locally, nationally, and globally, of course. We have an incredible team. Katie Kotchak is the leader of our team. You're going to hear from many of our wonderful project directors, Matt Kavanaugh, Jeff Crowley, Regina LaBelle. We have in front of us just an incredible day. Bill mentioned the incredible transformative work as HHS Secretary that Donna Shalala gave us. We've got Victor Zhao from the President of the National Academy of Medicine, Tony Fauci, who when I've introduced him in the past, I just simply call him a national treasure. Bruce Sabin of Salk Institute, Barley Jenkins, and many, many others. And Dr. Tedros, who we're going to be hearing from soon, the head of the World Health Organization, has been a steadfast partner. He recently co-authored a piece with me and others on the 70th anniversary of the Universal Declaration of Human Rights. We have a piece coming out in the Lancet together on improving the health of migrants and refugees, probably the transformative issue of our time. And in just a couple of weeks, the World Health Assembly, we hope is going to adopt the Global Action Plan on improving migrant and refugee health. This is a statement from Richard Horton. Hopefully you can people read that statement, or do I need to read it for you? I guess I'm going to need to read it for you. So Richard is the editor-in-chief of the Lancet, and he was right there at the beginning with John and I. His vision was that the medical profession and the health professions throughout the world really didn't understand law. And so he wrote, he has health issues at the moment, otherwise he would have come, he'd actually had his ticket to arrive here. But he says, the idea of justice is the foundation for health. The motivating principle underpinning the sustainable development goals of universal health coverage is the belief that every human being has the right to health and the right to high quality health care. But too often the health sector forgets the lessons of its success. The contributions of law and legal systems to justice for health have been decisive throughout the history of health and medicine. This commission, and then he mentions John and I, together with, among others, and our stellar team at the O'Neill Institute, sets out a powerful instrument to protect and strengthen health, making 7 recommendations, including what Richard is very committed to, and we are, a standing commission, a permanent standing commission on global health and the law, jointly between the Lancet, O'Neill Institute, and Georgetown University, which is a really wonderful credit to all of us. So I mentioned WHO. I had a senior official at WHO recently ask me the question. He says, well, Larry, you know, what does law have to do with health? And which is a standard question you always get. And so I paused for a minute, and the first spontaneous thing that came out of my mouth was everything. And truly, it is everything, because, you know, medicine, of course, is a lifesaver, and a doctor can save one life. But a good law with justice can save millions of lives. So just consider a few of these salient facts. Tobacco control in 59 countries across the world has saved 30 million lives. One tool alone, if we tax tobacco, alcohol, and sugary beverages, we would save 50 million premature deaths. I'm going to very briefly canvass several areas where law has a very major impact. Non-communicable diseases, diabetes, cancer, respiratory disease, heart disease, infectious diseases, injuries, and then I'll end with universal health coverage and the right to health. Overall, what law does is it helps us keep 2 fundamental global pledges. One pledge is that everyone must have an equal chance for a healthy and safe life, and the other is the UN Sustainable Development Goals promise to leave no one behind. So I've mentioned non-communicable diseases, things like tobacco control. The WHO's Framework Convention on Tobacco Control, enacted in 2003, led to a whole series of national laws on tax, minimum age purchase, smoke-free environments, marketing bans. In 120 countries around the world, there are graphic images on tobacco products. Australia, the UK, and many others now have plain packaging of tobacco. The CDC reports that here in the United States, with these laws, we've reduced smoking rates from 21% in 2005, just after the FCTC, to 14 or 13% today. Sugar taxes in Mexico led to a 14% reduction in the very first year of sugary beverages. The UK's sugar levy made companies transform their products even before it took effect. We've banned trans fat excess fat, salt, sugar. The O'Neill Institute has worked with the World Health Organization, particularly in the Middle Eastern region and the Western Pacific, to recreate laws that really solve many of the problems that they're facing. We can stop marketing junk food to children, healthy school meals. All of these are law. We could do the same thing for alcohol that we do with tobacco. Scotland, for example, now has a world-beating minimum price for alcohol unit. We can encourage physical activity, city planning and zoning laws for biking and walking paths, parks, playgrounds, mass transit, subsidies for fruits and vegetables. And of course, infectious diseases are really the beginning of how law began hundreds of years ago, all the way back to when John Snow helped pass an ordinance to take away the Broad Street pump that was putting out contaminated water that was causing cholera in Soho in London. Today, we're facing a vaccine hesitancy crisis that's led to the highest number of measles cases in the United States since it was eliminated in the U.S. In the year 2000. We're deploying safe vaccines now in the DRC in the Ebola epidemic, where laws being used for sanitation, vaccines, contact tracing, isolation, quarantine. We're seeing in the DRC with the violence and community distrust that we need to use other legal tools like good governance, smart diplomacy, security, bringing on board the Security Council of the United Nations, for example. The right to health litigation has led to access to antiretroviral treatments in South Africa and removed discriminatory criminalization of people living with HIV/AIDS. We also often don't think of injuries as a public health issue. In fact, we call them accidents, but they're anything but accidents. They're highly preventable. Think about firearms here in the United States. What if we were to do what most other countries in the world have done, ban assault weapons, required trigger locks, safe storage, smart guns, universal background checks? When Australia did that, their rates of firearm injuries and deaths plummeted. Or think about traffic safety laws, seatbelts, airbags, crumple zones, speed limits, impaired driving laws. These have transformed road safety throughout the world. One simple law in Vietnam, which is a country, as you may know, of motorbikers, requiring helmets, led to a 93% reduction in head injuries and fatalities. Universal health coverage, as many of our speakers have already said, based upon the right to health, needs law for high quality, equity, universal access. So many of us think that law is not about health, but it's about something else, and it's actually on the Bennett Williams Library, which is justice. Good governance and the rule of law are not only intrinsic values in their own right for justice, but they're very good for health. Good governance like transparency, non-corruption, accountability, civil society, and inclusive participation are critical. The rule of law brings stability, safety, and health. So the founding idea of the O'Neill Institute is what I like to call global health with justice. And that's what this commission does. Why with justice? Because you need both. You need global health, you need constant and ever-increasing improvements of the health of the population, but you need it with justice. You need fair distribution of the health and the value of health for all. So law is a powerful tool, and our Lancet Commission has demonstrated it, so we can make health, safety, and justice the healthier and fairer choice. We need to make it the easy choice. And so we begin this day with launching here in Washington, here at Georgetown University, the Lancet Commission on Global Health and the Law. It makes us all at the O'Neill Institute very proud, and thank you for coming and sharing this day with us.
Well, Larry, thank you. As always, I think you have an amazing way to put all the pieces together on why we're here today. And so, but before, I'm going to introduce the video from the Director General of the World Health Organization. But as always happens with these things, these commission reports take a lot of time and effort. And I just want to recognize a couple other people, in addition to Richard Horton at the Lancet, Pam Doss and Selena Lowe, who worked with us throughout this process. So thank you both for this work. I also want to acknowledge a couple other authors on the report who are also part of our family. One is Jenny Kaldor, who was the primary drafter of the final version of the report, and Eric Friedman, Katie Gottschalk, Susan Kim, and Mary DeBartolo. And I think Eric and Katie and Susan are all in the room here, so I just want to acknowledge them and thank them for their intellectual contributions to this final report. So thank you very much. It's funny introducing a video, but I'll try to do this but our next speaker is an extraordinary person. Dr. Tedros is the current Director General of the World Health Organization. He's the first DG from the Africa region of the WHO, and he also previously served as both the foreign minister and the health minister from his home country of Ethiopia. I first met Tedros when he was the chair of the Global Fund to fight AIDS, TB, and malaria when I was representing the U.S. on the board. And through his leadership, he really drove a policy of reform, change, and accountability that I think really put the fund on an incredibly positive path. He's also a visionary, as mentioned before. He led a remarkable transformation of health reform of the health system in Ethiopia, and he also has brought this passion to his work at the WHO. I think his Triple Billions initiative, meaning 1 billion more people with universal health coverage, 1 billion more people protected from global health emergencies, and 1 billion more people enjoying better health and well-being. That's an animating concept, and it's the kind of bold ambition that's characterized his leadership before and his leadership now at WHO.
Colleagues and friends, and thank you for the opportunity to speak to you at the launch of this timely report. I could not agree more that robust legal frameworks are critical to steering the global health agenda in the right direction. With them, we can organize health systems, we can protect rights, we can ensure access to safe health services of quality, we can prevent and manage public health risks, and we can address the social determinants of health. Legal instruments and institutions are critical to advancing universal health coverage and achieving the Sustainable Development Goals. Health equity is, after all, a question of justice, and health is a fundamental human right. Every human being is entitled to the enjoyment of the highest attainable standard of health conducive to living a life in dignity. That's what the World Health Organization was set up to achieve. That's why WHO is supporting governments and other actors around the world to better understand and make use of the law to improve the lives of their citizens and to engage more effectively across borders. But strengthening legal frameworks for health is not just a matter for lawyers. It's the job of policymakers, regulators, parliamentarians, health workers, and communities. Everybody has a role to play. I look forward to hearing your ideas on how we can harness the power of the law for global health and sustainable development. I thank you.
So well, we appreciate Tedros's remarks, and now I have the privilege of returning us to our live speakers here. And I have the honor of introducing our keynote speaker. Congresswoman Donna has had, as Bill mentioned earlier, has had an extraordinary career in public service. And she's just returned to Washington as a member of the new House class of 2018, representing Florida's 27th district that includes Miami and surrounding communities. Donna has served as the president of Hunter College, the chancellor of the University of Wisconsin, and most recently the president of the University of Miami. For 8 years, she served as the Secretary of Health and Human Services, the longest tenure of any secretary in U.S. history, and she was responsible in that role for numerous accomplishments, including the Children's Health Insurance Program, doubling the budget of the National Institutes of Health, securing the highest immunization rates in American history, and driving FDA's first efforts to regulate tobacco products. Donna also led the U.S. delegation to the World Health Assembly during her time at HHS and helped shape U.S. global health programs during her tenure. As a lawmaker, Donna now serves on the influential House Rules Committee, which yesterday just had its first hearing on Medicare expansion proposals, so she's back in the thick of it. And on a personal note, I just should mention that I had the distinct privilege of working for Donna for almost 8 years when she was Secretary of HHS. And during that time, I learned so much from Donna about federal health policy and management, but I actually learned even more from her about even more important things. Her deep personal commitment to public service, her firm moral compass in challenging and difficult times, and her passion for using the tools of government to make a difference for those left out or left behind. So I wish you join me in welcoming Donna Shalala to the stage.
Thank you very much, John. I'm a little intimidated by the audience. Shoot, I've got Tony Fauci and Tim Westmoreland and Victor Zhao, and I think Peter Piot was supposed to be here. At any rate, I had my career was really made by being able to work with absolutely first-rate people. If I have any skill at all, it's my ability to choose people to work with, as opposed to my own inherent talents. I do want to introduce three people. My chief, Jessica Killen, is back there, and she's actually a graduate of Georgetown Law School. And my deputy chief and LD, Carla McGarvey, is back there too. We already cornered Tim Westmoreland on a Medicaid issue. I'm not going to come here and see people who know more than I do without cornering them for ideas. And Shyla, is she here somewhere? This is Take Your Daughter to Work Day, and Girls Inc. has sent me a young woman. So I want you to welcome Shyla. So I thought I would I talk a little about the law, but I define the law as a policymaker broader than just legislation that's been passed, but of course, like all of you and like the report, it includes regulations, but it also includes goals. Because one of the things I learned at WHO and in the international organizations is that other than the United States, many of the countries of the world, when we set goals and agree upon them, take them seriously. And more than take them seriously, they work out strategies to try to meet these goals, and they're respectful of international organizations. We're about to pass, probably tomorrow, telling the president that he ought to not abandon the Paris Accord, for example. Every other country in the world signed on to it, and it couldn't be more important in terms of the sets of goals that countries have set themselves and their energy at meeting those goals, so that we can literally save the environment, but more importantly, save our lives in the future. I come from an area of the country where there are no climate deniers. For us, the climate is life or death. And so reminding the president that that Paris Accord is significant for the future of our country, and particularly areas like mine, is very important for the Congress to step up and do. At the beginning of the report, the quote was here: health risks in the 21st century are beyond the control of any government in any country. And that certainly is true. We know that about infectious diseases, but it's more than that. Because of the way people travel, because of the way they cross borders, their health is important to the rest of our health. And I'd like to start by actually going way back, and that is that we have made the greatest health gains in the world by looking back at our first ones, the initial public health moves around the world, but particularly in this country: sanitation, clean water, building codes. Who would connect building codes with healthcare? But building codes turned out to be extremely important in terms of the laws that related to health. Accident prevention, you've already heard some discussion of that, but it's not just seat belts, it's occupational health. The rules and the laws we put in place to protect workers all over the world, with the efforts of the international labor unions to protect worker safety. The control of infectious diseases, which we've seen more recently, but not simply the role of vaccines, but the teams, often led by the Centers for Disease Control, but now teams around the world who have had an impact. Family planning has been a very important contribution, and the laws related to family planning and the regulations have had a major impact on women and families' lives around the world. And of course, we've talked about tobacco as a health hazard, and then the new list that includes cardiovascular disease prevention, cancer prevention, lead poisoning, and all the kind of public health preparedness and response. In other words, every aspect of our lives are affected by our ability to put in place some kind of a legal framework and some kind of a regulatory framework. In the early days of AIDS, we fought stigma. Tony Fauci, as an extraordinary leader, we fought stigma as we tried to struggle with privacy decisions about should we notify the other partners, should we notify people that an individual with HIV had contact with. And we had to put in place rules and laws in the end. But in the end, we saved lots of lives. I remember my first week on the job at HHS. Tony brought up a group of little kids who had been infected because we had a blood supply that was not clean. And the kids all brought me pictures that they had written, that they had designed, and we put them up on the wall of the conference room at HHS. And I promised them that we would not take them down until we had not just a cure, but a way of containing HIV. Not one of those kids survived. Not one of them survived. And I left those pictures up to remind me of the job that we needed to do. We did clean up the blood supply. We made an extraordinary effort to do that. But more importantly, we put in place the new treatments that were developed and made them available to everyone, and through PEPFAR to almost everyone on Earth. And that took a legal and a regulatory framework and an investment of billions of dollars to make a difference to people around the world. We've had lots of experience with unjust laws. In HIV, of course, with the LGBTQ community or with marginalized people. Our laws have broken down in some cases, as we tried to deal with people's fears. But in a number of areas, HIV/AIDS, where we've made a substantial international investment, both in this country and abroad, and in tobacco, where we've taken a step forward. And I remember when we were struggling with international tobacco, talking to the trade representative about not cutting deals on behalf of the tobacco companies in the United States, allowing access to international markets because it was a health issue. And the trade representative actually was quite sympathetic, but the real person that was sympathetic, and the person that had the bigger impact than I had as a health minister, because the health ministers were all on broad, was the Secretary of the Treasury, because it was the finance ministers around the world that saw the income from tobacco, and it was convincing them that there was a higher cost than what they were going to get in taxes. And it was the Secretary of the Treasury that made the case, particularly in the globe, in some of the international meetings, to finance ministers that they should begin to move away from reliance on tobacco taxes for their income. That was a law that needed to be changed for the sake of the public health. Sometimes we've used the law and access to the law as a weapon. When the FDA decided to take on the tobacco industry in the United States, the Attorney General of the United States told me that she wasn't sure we could win the case because the law was not clear on whether the FDA, in David Kessler's very clever rendition, would be able to survive a Supreme Court case. And my response to that was, I didn't care, that this was an example where we would use the law and the threat of the law, and meanwhile, we were doing a set of moves at the state level where they were passing laws to keep the purchasing of cigarettes away from schools. We were using federal and state laws to take tobacco literally out of buildings so that people couldn't smoke, so that we had a multi-pronged campaign against tobacco to make it inconvenient for people to smoke. And then, of course, with a new organization, a campaign focused on kids. The key to that campaign was focusing on children. It was not a campaign that was just focused on adults, even though making it inconvenient to smoke in buildings obviously began to change the minds. I still, when I walk by a building and someone's smoking outside, say to them, that's bad for your health. Still, after 20 years, I'm still saying that. Why am I saying that? Because every year I get a letter from someone that says, you know, you said to my wife that she shouldn't be smoking. She came home and she said, you know, the former secretary of HHS said to me I shouldn't be smoking. And I said to her, she's right. And my wife stopped smoking. So I figured one at a time. But we'll always do that. So we used a combination of the law at the national level, testing whether FDA at the time could regulate tobacco, knowing there was some risk, but simultaneously passed laws in states and local governments, and at the same time got the Secretary of the Treasury talking to finance ministers all over the world. In addition to that, of course, the WHO at the same time was working on tobacco regulation and on a big international effort to do that. But it was the multi-layered approach using different parts of the law in different jurisdictions that had an impact in the long run. And then, of course, the tobacco companies and new companies did exactly what we expected to them. They pivoted, and now we have e-cigarettes. But the attitudes in this country about smoking have changed dramatically, and parents are kind of going crazy with the e-cigarettes, as are school children. So 2 weeks ago, Frank Pallone, the chair of Energy and Commerce, and I introduced a bill to extend the law and young people will have to be 21 now to purchase e-cigarettes or tobacco or flavored cigarettes. And we introduced a very comprehensive piece of law. And a week later, the majority leader of the Senate announced that he was also going to introduce a bill. He's from Kentucky. Talk about a change in attitudes. Well, the tobacco industry, the tobacco growers have changed. But he also heard from parents all over his district. He's up for re-election. Can't assign it just to that. But certainly, this is a new era in terms of attitude about cigarettes. And so we have a chance, with everybody talking about no bipartisanship, we have a chance of taking another major step in public health, specifically focused on tobacco, to again reiterate our position that young people should not smoke. And of course, we know from the data that if we can stop them smoking while they're in school, they won't smoke ever in the future. And so the flexibility, again, with a new set of laws focused on a new set of dangers, particularly to young people's health, we have a chance to step out and take another giant step in healthcare. Finally, let me take a couple of minutes and talk about the hearing we had yesterday, specifically on Medicare for All, which will be a great challenge. Fundamentally, and the World Health Organization has announced a new initiative on universal health care and their commitment to universal health care. I'm committed to universal health care. I have been my whole career. Our strategy in this country has always been to fill in the gaps. We start with Medicare and Medicaid for the elderly and for the young, where there was no private sector alternative. The consensus was that we should take care of seniors and of the poorest children and pregnant women because there was no private sector alternative. So there was consensus about the problem and consensus about a role for government. We saw it again in the Children's Health Insurance Program during the Clinton administration that was focused on the children of people that got up every day and went to work and couldn't afford health care, particularly for their children. We saw it again in Part D, the pharmaceutical benefit to upgrade the Medicare program from a 1965 program, at least to add a drug benefit for seniors. And we saw it again in Obamacare in the Affordable Care Act, focused dramatically on working families in this country, both the extension of Medicaid, which has been successful in almost every state, but we still have states for ideological reasons that have been unwilling to do it, and in the exchanges to cover pieces. We have, and I would not describe this as incremental because it involves millions and millions of people. We have slowly and carefully taken giant steps to try to close the gap. The big issue is that we have 29 million people that are not covered and probably 40 million people for whom are underinsured in this country. And most people with our fragmented healthcare system don't have an integrated care network. Our only real integrated care networks are a handful of very distinguished HMOs and the VA and the military systems, both military healthcare as well as TRICARE, where we see a truly integrated system. So our challenge is, what do we do next? Do we throw out the whole system and substitute taking an existing platform like Medicare and building it up, adding long-term care and other kinds of things? Or do we take the Medicaid program, or do we let people simply buy into one of these programs? Do we move away from the private healthcare system? All of them were put in place by a series of laws. In the case of the private healthcare system, much of it is covered by a committee I sit on, by the ERISA laws. In the case of the public healthcare systems, they're fragmented. Some are state-based and others are fully funded by the federal government. It's a fragmented system. If we had to start again in this country, we would not design the system we currently have. no one in this room would design the system. It has grown, and it has been cobbled together over a very long period of time working the politics. The question is, can we take that system and totally transform it? The problem we have is this fragmented system has a set of interests around every part of it. Not simply lobbyists with money, but a set of interests who have jobs and economic investments, and it's complicated. But we've taken big steps before, and it will be interesting to see whether we can take a big step again. Again, it will be lawmakers that debate this issue. And the first foray into a serious debate about universal health care, about one strategy called Medicare for All, one strategy. The first foray was in the discussion yesterday. It was the smartest discussion I've ever heard or experienced in Congress. It was a total wonky discussion. The Republicans and the Democrats were extremely well behaved. It wasn't very partisan at all. It was a thoughtful talking about what it meant if you were going to go to essentially a single payer system. That's hopeful, not because I think we're going to end up there, but because it means that all of us know that we've got to have something better, that we spend twice as much as anyone else on earth and we don't get better outcomes. And that's a very healthy discussion. But whether our legal framework in this country, whether the participants that make laws in this country can go that far, can take giant steps. We've done it before with big social programs, but often when we've had to either do it with one party or build a consensus around the country. And my experience is that we've got to have a lot of conversations before we get there. But again, it will be lawmakers that move us in this direction, lawmakers that set the tone, and laws that, and a framework with laws that will make a difference, not only for people in the United States, but for people around the world. We have taken giant steps in this world with AIDS, with tobacco, with vaccines, in the management of infectious diseases, with the introduction of infrastructure in primary care. And we're at a crossroads now, both in our country and around the world, in which we're going to see whether healthcare is a fundamental right and whether the people that lead the world's nations have the political will to step up and to take that right and to deliver for their people. Thank you very much.